Treating SIBO, you need to look at all the possibilities. When it comes to treating SIBO, there is not one size fits all solution. You need to think holistically and start by getting the proper diagnosis. Don't just Google your symptoms, get a breath test to confirm it really is SIBO you're dealing with. Before jumping into treatment, ask yourself, is my diet clean enough? A diet high in processed foods, refined grains, and sugars can fuel the growth of bacteria in your gut. Many people find relief by switching to a low FODMAP diet, which reduces the fermentable carbohydrates that bacteria love to feed on. Next, think about your gut motility. Are you helping it along? If you're sedentary, your gut might not be moving as it should. Even something as simple as a light walk after meals can make a big difference in improving gut motility. Also ask yourself, am I spacing out my meals enough? You should aim for at least 4 or 5 hours between meals to allow the migrating motor complex, your gut's cleaning system, to do its job. Constant snacking doesn't give your gut the break it really needs. And don't forget to check, am I taking any medications that could be affecting my digestion or gut motility? Medications like proton pump inhibitors, think omeprazole, lansoprazole. Other medications like antidepressants or anti-inflammatory drugs can mess with your gut, so be mindful how they are affecting you. Now that we've answered those questions, let's move on to the treatment options. First up, we have the antibiotics. For hydrogen-dominant SIBO, the go-to treatment is rifaximin. For methane-dominant SIBO, you'll need a combo of rifaximin and either metronidazole or neomycin. For hydrogen sulfide SIBO, the typical treatment is rifaximin with bismuth. But here's the catch. Sometimes antibiotics don't work. Why? Because the bacteria can hide deep inside the mucus layer of your gut, and antibiotics, which are water-soluble, can't reach them. They are working on treatments that targets this, but for now, the antibiotics have this limitation. Another option is herbal remedies, which have been shown in studies to be just as effective as the antibiotics. Powerful antimicrobials like oregano oil, berberine, allicin, and ginger work to kill the bacteria, and they're often gentler on the gut than the antibiotics. These herbs, they target the bacterial overgrowth without the harsh side effects that the antibiotics can sometimes have. For really stubborn cases of SIBO that don't respond to antibiotics or herbal treatments, there is the elemental diet. This is a liquid diet that gets absorbed quickly by your body. By the time it reaches the lower part of your small intestine, there is nothing left for the bacteria to ferment, essentially starving them out. The elemental diet can be highly effective, but keep in mind it's quite expensive. The best treatment depends on your type of SIBO, how your body responds to the treatment, and your efforts in managing factors like diet, exercise, and medications that can affect your gut health. Hope that helps. Follow for more tips on gut health.